Hello, everyone. In our revision lesson today, we'd be discussing ERP, that is exposure and response prevention technique. You'd come across ERP when you'd be studying the treatments and management of OCD, the treatment and management of OCD, that is obsessive compulsive disorder. Now, before we begin, I would want us to revise what ERP, that is exposure and response prevention technique, is. And then we would see if we've understood it well by having a look at this question that we have from March 2024. This is question number 3 from March 2024, paper 3. Now, without any further ado, let's start off with ERP. Now, as we speak about ERP, that is exposure and response prevention technique, this is an example of a psychological therapy. Understand this. Exposure and response prevention is a type of cognitive behavioral therapy. It is a type of cognitive behavioral therapy. Remember, the idea is to change cognitions, to replace irrational, illogical cognitions or thoughts with something that is more rational and makes more of sense. So, exposure and response prevention is a type of cognitive behavioral therapy that is used to treat OCD. In ERP, that is exposure and response prevention, individuals are gradually exposed. They gradually, remember, we're talking about a slow and a gradual process. Individuals are gradually exposed to situations or objects that trigger the obsessions. So we're talking about gradual exposure to objects or to situations that trigger your obsessions. And not only do they trigger your obsessions, they lead to the person, they would lead to you feeling anxious while being guided to resist performing their usual compulsive behavior. So, very simple, help with the exposure while at the same time helping the patient resist the compulsive acts, right? So, gradual exposure and guided resistance are the two key phases that we need to understand over here. So, exposure and response prevention, in exposure and response prevention, individuals are gradually exposed to situations or objects that trigger the obsessions and anxiety while being guided to resist performing their usual compulsive behaviors. For instance, someone who has obsessions with dirt and germs may be asked to touch a door handle, which would normally make them want to wash their hands. Instead of washing, they are encouraged to tolerate the anxiety and refrain from compulsion. So, this is very simple exposure and response prevention. If you understand these three words, exposure, response, prevention, you'd understand this entire technique. The goal of ERP is to help individuals get used to the obsessive thoughts and the resulting anxiety. Over time, they learn that these uncomfortable feelings reduce on their own without the need to perform compulsive behaviors. Preventing the compulsive response is essential. Preventing the compulsive response is essential. But at the same time, it's pretty important that you understand that an individual does feel anxious, does feel stressed, does feel depressed, right? Because of those persistent, intrusive, obsessional thoughts, right? So, preventing the compulsive response is essential as it allows the person to break the cycle of obsession and compulsions. Now, it's more like a vicious cycle. And a person, if you talk about someone who has OCD, the reason why I'm using the word a vicious cycle over here, because, a person would keep on feeling keep on having those triggering thoughts, right? I'm about something being dirty. I mean, there's a possibility you might feel like, oh, this is dirty, 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 because of which, these thoughts, these obsessional, these intrusive, these persistent, these reoccurring thoughts, right? They trouble an individual. They result in an individual feeling stressed, right? And to because you don't want to go through that experience, because you don't want to feel or experience that anxiety, you as an individual might end up acting in a very compulsive manner. What does it mean when you say acting in a compulsive manner? Acting in a compulsive manner, or in other words, to be able to break through that, right? You to be so I'm sorry, to be able to not feel that, you might end up acting in a manner, or you might end up being involved into a compulsive act, right? So the breaking of OCD, what is O is your obsession, C are your compulsions. Your obsessions are your thoughts, your compulsions are those acts that you use to be able to neutralize those intrusive thoughts, right? So now you thought of now you've come up with an alternative solution to this, right? You want to break that cycle, right? Preventing the compulsive response is essential as it allows the person to break the cycle of obsessions and compulsions, leading to long term relief from OCD symptoms. Now, this was a really quick revision of exposure and response prevention technique that is used to treat individuals who have OCD. Having a look at this question now, to begin with, Mary has obsessive compulsive disorder. She worries that something bad will happen if she does not check her front door is locked 20 times a night. That looks intense. So there's this lady with the name Mary. She has obsessive compulsive disorder. She worries that something bad will happen if she does not check her front door that is locked 20 times a night. Mary needs help with the symptoms. This is where the question begins. Suggest how exposure and response prevention can reduce number one, Mary's obsessions, number two, Mary's compulsions. Like I said, this happens to be a 4-mark question. For this 4-mark question, let's just say let's dedicate 2 marks for this and 2 for this, right? You could use it other ways too, but yeah, for now, let's keep it just and fair, 2 for each, right? Having a look at how the Cambridge wants us. You can do more on obsessions or on compulsions. Like I said, I mean, to me, 2 plus 2 seemed right. But if you are someone who wants to write down more about obsessions and a little less on compulsions, that's okay too, or vice versa. Now, for information, there is for just by providing information, this would not be worthy of any credit. Exposure and response prevention involves number one, introductory sessions where the obsessions are identified. So introductory sessions is what we is required. Number two, treatment sessions where clients are given tasks to do each week where they gradually stop doing their compulsions. Let's put this over here, where you gradually stop doing your compulsions so that they will learn that the outcome that they fear will not happen. So a gradual process where you stop acting in a compulsive manner, and once you're able to do so, you learn that these compulsions weren't really necessary at the first place. Over time, over time, the exposure will be increased until eventually the client experiences little to no obsessions and anxiety over not completing their compulsions. So these are the points, if I may break it. This is how ERP looks like. So this is a second revision to what we just did a minute ago. Let's make this red so that it looks different. Now, having a look at the question again, award 3 to 4 marks for a detailed answer with clear understanding of ERP linked to helping Mary with both her obsessions and compulsions. So you need to be able to demonstrate a clear and a thorough understanding of what ERP is. It needs to be detailed. Remember, if you want to hit a 4 on 4, do not miss on these points. But at the same time, you also need to ensure that you are connecting it or you are linking it to the case of Mary. Remember, this linking part is very important as well. Having a look at the example that the CI has provided us, Mary would begin ERP by explaining her obsessions with something bad happening and the compulsions that she needs to lock her front door 20 times. This is how the Cambridge would award you 1 mark. For the second mark now, during therapy, Mary would gradually lock her door fewer times each evening until eventually she would leave her door unlocked. This is how you receive your second mark. The third one, Mary would experience anxiety and an increase in her obsessions that something bad would happen. This is where you receive your third mark, taking it ahead. But this would reduce as nothing bad would happen to her, and eventually Mary should no longer need to lock her front door 20 times, and her obsession would reduce as the thing she feared did not happen. Remember, your obsessions are your thoughts. Once you do not have those intrusive thoughts, you'd be fine. You'd be totally fine. This is how you scored your first mark, the second mark, the third mark, and the fourth mark over here. So this was 3A. Having a look at the second part to this question, that is 3B. Explain one weakness of using ERP to marry. So you need to break this down into into 1 marks each. You need to give one weakness of using ERP, and you need to connect it to marry to get the second mark. The first mark from here, the second mark from here. One weakness over here could be the treatment will be very stressful for Mary. Of course, you're trying to constrain yourself, you're trying to resist that urge of being involved into that compulsive act. The underlying cause of a OCD is not being treated. So, whatever led to it is not being treated. You are just finding a solution to what is happening. You're not trying to figure out what led to it. The amount of time this takes, this could take 6 to 12 sessions. And of course, with time comes cost. This might be very costly as well. Now, taking this ahead, having a look at the example, the treatment. Now, see, we have to connect it to Mary, right? To be able to score both the marks. The treatment will be very stressful for Mary. Number one, that's a weakness. Let's elaborate it. It may be difficult for her to do the therapy as her anxiety about something bad happen if she doesn't lock her front door 20 times will worsen to begin with, right? Of course, it was something that used to cause you a lot of trouble, that used to cause you a lot of anxiousness, a lot of stress. So whatever was causing you stress, you are being told, you're being made by the therapist to resist that urge of being involved into a compulsive act. So this was a very quick little revision of ERP, that is exposure and response prevention technique. And while revising this, like I said, I picked up a question from March 2024 A2 psychology syllabus paper, A2 psychology paper. This is the clinical psych part where we picked up question number 3 and we discussed question number 3A and 3B both. I hope this was helpful. Thank you.